Have you ever had a reaction that felt far bigger than the moment in front of you? Maybe someone's tone of voice shifted. Maybe a partner went quiet. Maybe you received feedback at work and the bottom felt like it was going to drop out. And suddenly, the shame flooded in, the fear took over, or everything just went flat and you wanted to disappear. And that's when you thought, why am I reacting this way? It doesn't make sense. That experience is often described as an emotional flashback, a sudden emotional reliving of past trauma in the present moment, but often without a clear visual memory attached. Hi, I'm Dr. Sheila Vidal. I provide ACT-led trauma-informed therapy for adults in California and Virginia, and I create these videos to offer grounded psychological education you can bring into everyday life. Today, I'm going to explain what emotional flashbacks are, how they fit within complex PTSD, how they differ from panic attacks and classic PTSD flashbacks. I'll discuss what commonly triggers them in daily life and in your relationships. I'll tell you how acceptance and commitment therapy, ACT, can help you respond with more awareness and choice. I've also created a full article on my website that covers everything in this video, along with additional information and resources. I'll link it in the description and point you to it at the end. Before we begin, this video is educational and not a substitute for professional care. If you're in crisis and in the United States, please call or text 988. What exactly is an emotional flashback? An emotional flashback is a sudden, intense surge of shame, fear, helplessness, abandonment fear, or dread that makes emotional reality of past trauma feel active in the present moment. What makes them especially confusing is that they often don't include a clear visual memory. You may not see an image from the past. You may not consciously remember a specific event. You may simply feel the emotional state fully right now. So instead of thinking, I made a mistake, your mind goes straight to, I'm bad. Instead of noticing that person went quiet, your body may react as if abandonment is already happening. Instead of feeling this conversation is uncomfortable, your nervous system may respond as if real danger is present. Emotional flashback is not a formal diagnosis by itself. It's a clinical framework term for an experience that maps onto recognized complex PTSD symptom domains, especially re-experiencing in the present and affect dysregulation. In plain language, the past isn't just remembered, it's emotionally relived. What is complex PTSD and how do emotional flashbacks fit in? To understand emotional flashbacks, it helps to understand where they fit in clinically. Complex PTSD, or C-PTSD, is recognized by the World Health Organization in the ICD-11. It includes the core PTSD symptoms plus 3 additional disruptions called disturbances in self-organization. These include affect dysregulation, which is a severe difficulty managing emotional states, a negative self-concept, which is a deep, persistent shame and self-criticism, and disturbances in relationships. Clinically, emotional flashbacks can be understood as sitting at the intersection of these 3 patterns. The re-experiencing piece explains why the past feels so emotionally present. The affect dysregulation piece explains why the reaction can be so fast and intense. And the negative self-concept piece explains why shame is usually central. And the relational piece explains why emotional flashbacks are often so triggered in relationships. What do emotional flashbacks actually feel like? Emotional flashbacks can show up differently from person to person. For some people, they arrive as flooding, a racing heart, tight chest, overwhelming shame, urgency, anger, or panic-like sensations. It could be a strong pull to fix something immediately, apologize, over-explain, or even escape. For others, they arrive as shutdown, numbness, heaviness, blankness, disconnection, difficulty speaking, or a strong pull to go somewhere, be alone, and disappear. Both are consistent with affect dysregulation and complex PTSD. One body goes into high activation, another goes into collapse. And some people move between both at different times, depending on the specific trigger. Shame is usually central. This isn't mild embarrassment or an ordinary regret. It's a sudden, consuming sense of being bad, wrong, defective, too much, or unlovable. And it feels completely true in that moment. Thoughts like, I'm broken, I ruin everything, or no one will stay can arrive with an absolute quality that's hard to step back from while the episode is active. One of the most disorienting features is what I describe as a felt time collapse. Your adult mind may know you're in the present. You may know who you're with and where you are, but your body and emotional system may be reacting as if a previous relational experience were happening again. That's why telling yourself, I know I'm safe, is often not enough. The response isn't purely cognitive, it's emotional, physical, and relational. After an episode, many people feel exhausted, confused about what triggered it, and ashamed that the flashback happened at all. That shame matters clinically. It can become a second layer of distress on top of the flashback itself, reinforcing the negative self-beliefs that are often associated with complex PTSD. How emotional flashbacks differ from panic attacks. Panic attacks and emotional flashbacks can look similar from the outside, and they can happen at the same time, but they're organized differently. A panic attack is usually centered on physical alarm. The fear is something's wrong with my body. I might be dying. I might faint, or I might lose control. So the threat the mind is predicting is more of a bodily catastrophe. An emotional flashback is usually centered on emotional and relational threat. The experience is I'm bad, I'm unsafe, I'm being abandoned, or I'm powerless. The threat the body's responding to is relational, internal, and connected to a previous environment. Shame and negative self-concept are not typically primary features of a panic attack, though they're central to emotional flashbacks. A panic attack typically peaks within minutes. An emotional flashback can last minutes, but also hours, especially if it turns into rumination, self-attack, reassurance seeking, or withdrawal. So a more precise question to ask yourself in the moment isn't just, am I anxious? Instead, it's, what is my body actually afraid of right now? Is it afraid of a purely physical catastrophe? Or is it reacting to shame, abandonment, helplessness, or a perceived relational danger? And that distinction is important because it can help you choose a more accurate response. How emotional flashbacks are different from classic PTSD flashbacks. A classic PTSD flashback typically involves re-experiencing a specific traumatic event through sensory or narrative content like images, sounds, smells, bodily sensations, or a clear felt sense that the specific event is happening again right now. An emotional flashback may not have that clear sensory replay. Instead, the emotional state returns. The shame, the fear, the helplessness, the abandonment dread, the sense of being small, trapped, or unsafe. That's why emotional flashbacks can be so hard to identify. There may be no clear memory or no obvious image or no obvious reason for the intensity, but the emotional system is still reliving something. So instead of replaying an event like a scene you remember in a movie, this may be reliving fear, helplessness, shame, or body sensations connected to past traumas, but often without recognizing the source. Why emotional flashbacks feel so overwhelming? This is a question I often hear in my practice. How can such a seemingly small thing produce such a big, intense reaction? The trigger doesn't have to be so obvious or intense. The nervous system may not be responding only to what's happening now. It's usually comparing the present moment to an earlier experience of danger. So when something feels similar enough, even in a small way, the body can react as if the original threat is happening again. This is why insight alone doesn't stop the episode. Telling yourself, I know I'm safe, operates through a verbal conscious system The emotional flashback is being driven by a different system that was shaped by experience, not by reason. Not something's wrong with me, but my nervous system learned something very specific in an earlier environment, and it's applying that learning right now. What commonly triggers emotional flashbacks? Emotional flashbacks are often triggered by interpersonal cues, especially cues that resemble earlier experiences of rejection, criticism, danger, or emotional abandonment. This might include a sudden shift in someone's tone of voice, a look of disappointment, mild criticism, conflict, a partner going quiet, a friend not responding, being talked over, or feeling dismissed. Even when the present situation is not actually dangerous, the nervous system may recognize something familiar and react as if an old threat is happening again. Intimacy and closeness can also be triggers. For adults whose attachment relationships were the sources of harm, the experience of feeling close to someone can activate the same threat systems that were engaged when closeness previously preceded harm. One of the more counterintuitive features of complex PTSD is that the things we want the most can often feel the most threatening. Internal states can also trigger flashbacks. Fatigue, hunger, physical pain, self-critical thoughts, perceiving that you made a mistake. Even feeling happy or hopeful can be a trigger for some people. If positive emotional states were historically followed by harm or disappointment, that can trigger an emotional flashback. It's also very common not to recognize an emotional flashback right away. Many adults with complex PTSD only realize what's happening after they're already deep in the emotional response. The trigger may have happened earlier, and the connection may only make sense when looking back. That doesn't mean you did anything wrong. The goal isn't to catch it perfectly every time. The goal is to begin recognizing the pattern earlier, because earlier recognition creates more choice about what happens next. How does ACT help with emotional flashbacks? I want to be precise about what ACT does here. ACT is not a technique for eliminating emotional flashbacks. The goal is not to make them stop happening. Instead, the goal is to build psychological flexibility. That means the ability to notice what's happening inside you, make room for difficult emotions and body sensations, unhook from shame-based thoughts, and still choose a next step that reflects your values, even when the flashback is active. In ACT terms, emotional flashbacks are often understood as maintained by three patterns. The first pattern is experiential avoidance. This means trying to escape, suppress, numb, or control what's happening inside, including painful emotions, thoughts, memories, or body sensations. The second pattern is getting hooked by shame. Thoughts like, I'm broken, I ruin everything, can start to feel like facts rather than painful thoughts passing through the mind. When that happens, shame doesn't just feel like something the person is experiencing. It starts to shape the way they see themselves, what they believe they deserve, and how they respond to other people. The third pattern is that life can start to feel smaller. Over time, more and more energy goes into avoiding the people, places, conversations, or situations that might trigger an emotional flashback. ACT targets all three patterns. Acceptance helps reduce avoidance. Diffusion helps loosen the grip of shame-based thoughts. Values and committed action help people begin rebuilding a life that's guided by meaning rather than organized around avoiding triggers. Let me walk you through 6 ACT skills that map directly onto what happens during an emotional flashback. These aren't quick rescue techniques. They're practice capacities that build over time. In the beginning, even using one of them during an episode can be meaningful progress. Skill 1, notice and name. Recognition is the first skill. When an emotional flashback is happening, the feeling can seem like proof that something's wrong right now. Instead of assuming the emotion is giving you an accurate read of the present moment, try naming what's happening. Recognition can sound like, this feels bigger than the moment I'm in. The goal isn't to dismiss the feeling or force it to go away. The goal is to notice that the intensity of the response may be connected to something older than what's happening right now. That naming doesn't stop the flashback, but it creates space between you and the emotional state. And that space is where choice begins. Skill 2, ground in the present moment. Grounding helps reorient your attention to the present moment through your senses. The flashback doesn't have to be fully gone before you begin this. You're simply helping your mind and your body notice where you are right now. Name 5 things you can see. Press your feet flat to the floor. Feel the texture of something in your hands. Breathe slowly with a longer exhale than inhale. The goal is not to suppress the flashback or force it to stop. The goal is to widen your awareness so that you can notice both the emotional response and the present moment at the same time. Skill 3, diffuse from shame thoughts. During a flashback, shame thoughts arrive with an absolute quality. I'm broken. I'm too much. I ruin everything. Diffusion means changing the relationship to those thoughts without arguing against them. We can't change our thoughts in that moment, but we can become practiced at changing our relationship to them. We don't have to deem every thought as an absolute fact. Instead of I'm broken, try noticing I'm having the thought or the feeling that I'm broken. Instead of I ruin everything, try my mind is telling me the story that I ruin everything. That small shift doesn't make the thought disappear, but it can help create space between you and the thought. The goal is not to argue with the thought or prove it wrong. The goal is to notice the thought your mind is having so that it has less power to drive your next move. Skill 4, practice acceptance. Acceptance in act doesn't mean approving of what happened to you. It means making room for painful emotions, memories, and body sensations without spending all of your energy fighting them and without waiting for them to disappear before you take your next step. Ask yourself, can I make room for what I'm feeling right now, even a little, while still moving towards something that matters to me? When you try to fight or shut down what you're feeling, the distress often gets louder. The episode might start to feel more intense or more drawn out. Making room for emotions, memories, and body sensations doesn't make them easy, but it can reduce the extra suffering that comes from attacking yourself for having them. Skill 5, accessing the observing self. During an emotional flashback, the sense of self can collapse into the emotional content. You're not observing shame, you become it entirely. Just begin by noticing, there's a part of me that's aware the flashback is happening right now. That awareness is the observing self. It can't be overtaken by the flashback. It's always there. This practice directly challenges the negative self-concept pattern at the core of complex PTSD by establishing that you're more than any single emotional state you're experiencing. Instead, there's a part of you that notices and observes it. Skill 6, take one values-based action. Ask yourself, if shame weren't in charge of my next move, what would I choose? If fear were allowed to be here, but not allowed to drive, what would I do next? That might be taking a pause before responding, or putting your phone down, or sending a brief message to a trusted person in your life, stepping outside for 2 minutes, returning to a task that matters, or choosing not to act on a shame-driven urge. The step doesn't need to be large. It needs to be workable. Here's a 5-step act reset for emotional flashbacks, a short sequence you can practice when you have a moment to pause. Step 1, name the moment. This is an emotional flashback. My body's responding to something from the past. Step 2, name the emotion. Shame is here, fear is here, abandonment is here. Step 3, orient to the present. Look around the room. Name where you are. Feel your feet or wiggle your toes. Take deep breaths and let the exhale be a little longer than the inhale. Step 4, diffuse from the thought. My mind's telling me that something's wrong with me. My mind's telling me I'm not safe. Notice a thought as a thought not as a truth about who you are or what's happening in the moment. Step 5, ask a values question. What would the person I want to be do right now, even if that's just one small step? Notice, name, ground, diffuse, and act. These skills become more available to you the more they're practiced outside of flashback states, like when you feel irritability or mildly anxious, and you feel a sudden urge to react impulsively. They're not techniques for the peak of the storm. They're practice skills you can build so you're better prepared when the storm arrives. When should you reach out for professional support? Reaching out for professional support is a very personal decision, and it usually works best when it feels like it's the right next step for you. So I want to speak directly to those of you who are wondering whether what you're experiencing warrants professional support. Professional support may be worth considering when emotional flashbacks become frequent, last for hours, affect your relationships, or make your life feel increasingly organized around avoiding triggers. It may also be helpful if shame and self criticism feel constant, or if you're using substances or other high cost ways of coping just to get through the emotional intensity. Many adults with complex PTSD put off seeking support for reasons that make sense. They may minimize what they're going through, or think it's not valid, or worry that they should be able to handle it on their own. But you don't need a confirmed diagnosis to reach out for professional help. Many people start by simply naming the patterns they notice just aren't working for them anymore, and they want help understanding them better. In my practice, the early work focuses on stabilization, emotional and behavioral regulation, and then we move on to values work before introducing deeper trauma processing. So it's a paced approach and is completely dependent on my client's readiness and consent. If you're in crisis right now and you're in the United States, please call or text 988. Veterans and service members can press 1 for the Veterans Crisis Line or text 838-255. Everything I covered today is based on a detailed, research-grounded article on my website. The full article goes deeper on everything we covered today, including a comparison table, trigger categories, and the full ACT skill sequence with specific practice language. You can find it at nextmissionrecovery.com under the blog titled Emotional Flashbacks in Complex PTSD, What They Are and How ACT Helps. And if you're in California or Virginia and you would like to explore working together, I provide ACT-led telehealth therapy for adults across both states with limited in-person sessions available in Folsom, California by appointment. If parts of what I described today feel familiar, I want to pause here and speak directly to you for a moment. You haven't been overreacting. You haven't been too sensitive. Your nervous system adapted to experiences where staying alert, guarded, or careful may have helped you survive. And it's possible to build different relationships to those responses at a pace that feels manageable with the right support. That's precisely what ACT-led trauma-informed therapy works toward. Thank you for spending this time with me. If this video supported you today, I hope you'll check back in for more ACT-led trauma-informed psychoeducation with me, Dr. Sheila Vidal of Next Mission Recovery. I'll talk with you in the next video.